Good morning, Sir Roldan Kotik. I am Hoof and I will be teaching you migraine today. So how are you this morning?
Thanks God, I'm okay. I arrived safely here.
That's good to hear.
Nice meeting you too.
And thank you for this opportunity to teach you regarding this topic. So before we start, I would like you to, I will be presenting a video about our topic
Okay.
today, and it will just be a short presentation.
Okay.
So I have my laptop with me and I will let you see the presentation, and this will just take 3 minutes.
Okay.
Migraine is far and away the most common, debilitating primary headache disorder. And it comes with a constellation of things beyond the headache pain that impact them, that impact their activities of daily living, and affect their ability to do the thing that they love most. We know that it's from changes in the body and the brain's chemistry. And we know that genetics accounts for about half of all migraines. And sometimes we think about the migraine as just the headache. One really goes well beyond that. Migraine is the type of headache that typically affects one side of the head and oftentimes are associated with nausea, vomiting, light sensitivity, sound sensitivity, smell sensitivity. Also in terms of what the pain feels like to someone. Is it sharp, stabbing, dull, aching, throbbing? They don't feel well, or they don't feel like they're their usual selves for the days before their migraine attack. Sometimes they're present physically, but they're not fully there. Sometimes people feel washed out, they don't feel themselves after the headache pain has gone away. And sometimes also those same people would share that it took a while to speak up and have courage to talk about the migraine or their headache, in part because if they had in the past, it was sort of dismissed. It's just in your head, it's just a migraine, it's just a headache. When it's not, it's something that profoundly affects someone and profoundly affects their family. If people are taking over-the-counter medication to treat their pain multiple times a day or even on a daily basis, that tells me that there's something going on that we need to investigate further. And paradoxically, over time, if people are taking daily, multiple times daily, as needed pain medication, that could actually make the headache worse that they're treating. And sometimes they could develop a new type of headache on top of that. But also that typically tells me that someone would benefit from a preventive medication or some other preventive therapy. In the last almost decade, there's been dozens of new treatments that have come out for migraine and other types of headache disease. Some of these are in completely new families of medications. Some of these are new formulations of medications that have been around for quite some time. Some of these are not medications at all. There's some really good evidence for some vitamins and supplements that can work really well to help prevent migraines and help to reduce the severity of migraine attacks when people get them. There's neuromodulation or devices. There's several of them on the market, and there's more coming. They can be used for prevention, so use it every day or sometimes more than once a day. And there's some that you could use in the throes of a migraine attack as well. Talk to someone about it. Bring it up. Headache and headache pain is not just in your head. It is very real. And if you bring it up to a doctor and they're dismissive, find someone else to talk to you about it. Because there are people out there that want to understand your pain, want to understand it so we can help treat it. You don't have to suffer in silence.
All right. So that's about migraine.
Okay.
So I believe it is like a summary of our discussion today, in that because it defines migraine, it presents medication that can treat migraine and also preventive ways to manage migraine. So along the way, we will be discussing about it. So now I'll give you your handout. I prepared a handout for you
Yeah, thank you.
that we'll go through with it this morning. So before we continue, I'm gonna ask you, because you have been experiencing migraine before. Will you be able to give me some of those experiences about migraine and some symptoms that you had?
Yeah, I remember the time when I experienced severe migraine. Like I was sitting in a room, and then suddenly I see some flashing lights, and then suddenly
Okay.
it seems like I'm losing my vision, and
Okay.
then I see my seatmate, because eventually we were at the school at that time. I see her, like half of his face is I can't see the half of his face,
Okay.
but I can see the half. It's like
Oh.
yeah, and after that, that's what I remember. And after that, I asked to go back in our quarter, and I closed the door, and I don't want to see the light. I don't want to
To hear
hear any
noise.
noise, and I don't want some sort of smell, especially the
Yes.
smell of perfume.
Yes.
So I went inside the room and closed the door, and I sleep.
Yep.
And then later, maybe an hour, I feel a very, very excruciating pain
Pain.
in the left side of my head that I can't bear it. So I asked our principal to go and consult a doctor about it. And the doctor is just guessing in a lot of things. He said sometimes that maybe you have a tumor in your head or whatsoever. She told me a lot of things that scared
Okay.
me. But thanks God, it was not that kind of sickness that I have a tumor, but it's just an aura migraine. So that's what I remember regarding migraine.
Yeah. And I think you have some information. That's why you've said it's an aura migraine. So that's one type of migraine, and we will go through that along the way. So
Okay.
thank you for all those information that you've presented to me regarding your experiences with migraine. So now we'll define migraine. Of course, this is the very thing that we need to look into. What is it that causes your all those experiences? And of course, that's migraine. So let's go ahead and define it. So migraine is a severe headache that causes throbbing, pulsing head pain on one side of your head. The
Okay.
headache phase of a migraine usually lasts at least 4 hours. 4 hours, but it can also last 4 days. This headache gets worse with physical activity, bright lights, loud noises, strong odors. So, like what you've said a while ago, that's very true, because according to our sources, it presents that if you have this, or you encountered, like, if you're having a migraine and you do not want loud noises, you do not want strong odors like perfume, you do not want bright areas, so you want just in a dark room without any noises and without any kind of odors.
Yeah.
So those are the things that you need to do when you are in a migraine attack. And that's right, you have migraine. So it is also disruptive. This kind of sickness is also disruptive because it can interfere with your daily routines. You will be unable to do your job. Like if you're a student, you need to go, or you have to be absent at school because you are unable to focus as well with your class. So yeah, it's really disruptive. And the next thing that we need to learn about this is that what are those types of migraine. and you've said one a while ago, aura migraine. So there are lots of migraine types, but the two most common is, the first one is the migraine with aura, which you've said earlier. This is a classic migraine. So this type of migraine, there are warning signs before the migraine attack begins. So like seeing flashing lights, those are symptoms. Seeing dots, zigzags, it also includes like inabilities to speak. For other people, they are unable to speak. There are also the feeling of pins and needles, like there are needles in the different parts of the body. So those are the warning signs. These are the warning signs under migraine with aura. So for migraine without aura, which is the common migraine, and this is the type of migraine without warning signs. So that's the difference. So with aura, there are warning signs, and those
Okay.
includes like flashing lights, seeing dots and zigzags, like that. But with the common migraine, which is the without aura, there are no warning signs. Yep. So let's go ahead. Do you have any questions regarding those that I've said?
So far it's okay. I
Okay.
don't have any question for now.
All right. Sounds good. So we'll go then to the phases of migraine. That we are still in page 1. So there are four types. Four stages of migraine. The first stage here is the prodrome. It is the first phase that begins up to 24 hours before you experience a headache. So this is the first stage, and this will take up to, there are in some people it will be beyond 24, but normally that will take till 24 hours. And imagine it's just the first stage. So we go to the second stage, which is the aura. This is the group of sensory, motor, and speech symptoms that act as warning signs of a migraine headache. In this phase, it can last long as 60 minutes or as little as 5. You might experience both the aura and the headache at the same time. So this is the phase wherein you are experiencing. So maybe those time when you are experiencing flashing lights, like that, or those that you are vision changes, it's you are already on the second stage, which is the aura. And the third stage is the headache. This is the headache attack already, wherein it can last from 4 hours to 72 hours. Now, we'll go to the last stage, which is the postdrome. This stage usually lasts for a few hours up to 48 hours. The symptoms feels similar to an alcohol-induced hangover, which is why the postdrome phase is known as migraine hangover. So if you experience before, if you have drink alcohol, and when you wake up in the morning, it's terrible feeling. So that's a hangover, alcohol hangover. But in here, it's a migraine hangover. So they are similar. That feeling is similar. So from the first stage till the fourth stage, that can take 8 to 72 hours. So that depends to each person. So some people will just take 8 hours for them, and some people can take up to 3 days or till 72 hours. So those are the 4 phases of migraine. So now we'll go to the symptoms of migraine.
Okay.
Okay, So with all those 4 phases, the symptoms of migraine can also be on each phase. So for the first stage, there are specific symptoms on it. Even the second phase, the third and the fourth phase, there are symptoms under those stages. So we'll go through the first stage, which is the prodrome symptoms. The symptoms in here are mode changes, difficulty concentrating, trouble sleeping, fatigue, nausea, increased hunger and thirst, and frequent urination. But before we continue, I also have my visual aids in here that can help you with how you understand the symptoms, and this is for you. You can keep it.
Okay, thank you.
So as you see, there is a prodrome symptoms in here. So you can see that all the faces of that woman, you can identify what he is suffering from. So for this one, there's a mood swing, food cravings, feeling hungry and thirsty, increased urination, all of it. So this will guide you with the symptoms of migraine. So let's continue. So these are the first symptoms that you can experience during migraine. So
Okay.
the second stage wherein we also have those symptoms under it, which is the aura symptoms. These includes muscle weakness, vision changes, ringing in your ear, like there's something maybe that you can hear actually, but there's nothing going on. It's like there's something that you can hear inside. There's also sensitivity to touch, like someone is touching you, numbness and tingling, difficulty speaking or concentrating. So those are the aura symptoms. So I believe during the time when you are seeing like a flashing light or vision changes, you are already in the aura stage. So next one is the headache attack symptoms. This is the third stage. In this stage, the symptoms will increase, or it will be more intense. So the head pain gradually gets more intense. So it will affect one side of the head, or both. So it depends on each person. Maybe some of those just one side, the other will be both sides. But generally, it is with other symptoms including nausea and vomiting, light, sound, and odor sensitivity. What else? Usually, those are the symptoms under this stage. So nausea and vomiting, light, sound, and odor sensitivity. So remember, if your changes, there are changes in your vision, that's still the aura symptoms. But if you already experience like light, sound, or other sensitivity, that you are already on the third stage, which is near the fourth phase. So yeah, just remember these symptoms so that you can identify which stage you are, and that might help, like thinking, yeah, I'm nearly done with my migraine, like that. So the last stage, which we'll discuss the symptoms. These include fatigue, stiff neck. Before, did you have the stiff neck or?
Yeah, sometimes I have.
Okay. So these are the symptoms for the last stage. You also have, this also includes sensitivity to light and sound. So these go together, maybe they're just near. And there are also difficulty concentrating, nausea, dizziness. So even the last stage, you can still experience dizziness and nausea. Okay.
Okay.
All right, so maybe that visual aid will help you with understanding migraine symptoms, because it shows the different emotions of that person, and that will be easier for you to understand. So now we'll discuss the causes and triggers of migraine. But first of all, I want to say that the exact cause of migraine is unknown. Okay, but it's thought to be the result of abnormal brain activity temporarily affecting nerve signals, chemicals, and blood vessels in the vein. So mainly it's the processes that's occurring in our brain, and around half of all the people who have migraine have close relative with the condition. So this suggests that genes may play a role. So probably it's genetic as well.
Okay.
Okay, so we'll go to migraine triggers. So what trigger migraine that we are experiencing, that people are experiencing? So first in here, especially for women, so I think that would be on page 3. Page 3. This one. Especially for women, the hormonal changes in women, the fluctuation of the various hormones, example, the estrogen, such as before and during menstrual period, pregnancy, and menopause. These will trigger headache in many women.
Yeah, it's okay. I am not a woman anyway.
So that's good, but the other triggers in here might apply to you. There are also oral contraceptives that can worsen migraine. In some women, they find that oral contraceptive will cause them less to experience migraine, but the others, it causes them more. So it really depends on each person. So next one is drinks.
Okay.
So these include alcohol, especially wine, and too much caffeine. And I bet you are a coffee drinker.
Yeah, but sometimes I believe that it applies to me in a reverse process, because when I don't drink coffee, I don't have energy, and it's like it triggers my migraine, so I have to drink coffee.
Oh, so that's how you
It's
found
like
out, yeah.
my brain is looking for a coffee, and if I don't give, it's like a baby that is whining, that trying to,
Oh, you're craving for
yeah,
it.
and my brain is signaling like, oh, I need a coffee, I need
Okay.
caffeine,
Yeah.
so I have to drink coffee.
Yeah. I think what it says in our resources is that too much caffeine.
Okay.
So I believe if you're taking it moderately, that's okay. But if you're taking it at high amount, maybe that's but not good. But if that works for you, taking it moderately, then go for it.
Yeah.
So we're just talking with the triggers that it depends on people. There are some who are taking these specific drinks, and they're not experiencing migraine, but there are those who will. But what I've said, it depends on each person's body processes. Okay, so the next one in here is emotional triggers like anxiety, depression, and stress. So we have lots of stress sources like at home or even at workplaces. This can cause migraine. So there should be a way for us to manage our anxiety, depression, or stress in order to not to trigger migraine.
Okay.
Okay. Next one, We also have this sensory stimuli like bright lights, flashing lights. These can induce migraine. Loud sounds, even strong smells such as perfume, paint thinner, secondhand smoke, even smoke. These will trigger migraine. So maybe we're just gonna avoid all of this. Okay, next one, sleep changes. If we are missing sleep or getting too much sleep, because getting little and getting, if we are living on extremes, it's too bad for our health. So getting little and getting too much sleep can trigger migraines in some people. Next one, physical strain. Intense physical exertion, including sexual activity and strenuous exercise, might provoke migraine. Okay, so I believe we have to do all physical activities in moderation.
Okay.
Next one, weather changes. A change of weather or barometric pressure can prompt a migraine. I remember when we just came here in this country wherein there's 4 seasons. There are those change of seasons, and like if we change from one season to another, the weather will be different, right? And it triggers migraine because with all the weather condition that can trigger a migraine attack. So yeah, that would also be a factor for why you'd experience migraine before. And next one is medication, like what I've said earlier. Oral contraceptives and vasodilators such as nitroglycerin can also aggravate migraine. We also have some foods that includes aged cheeses, salty processed foods. We have chocolates, citrus fruits. These can trigger migraine. Even skipping meals, that can also trigger migraine. And the last here on my list are food additives. These include sweetener aspartame and the preservative monosodium glutamate. These are found in many foods like those that we are buying in groceries, in freezers. We're in like there's hot dogs and hams. This contains lots of food additives. So I believe it's just good that we go for moderation and not for extreme ones. All right, so that's all for migraine triggers and cause. Then now that we've identified or defined migraine, we also have known the different types of migraine, even the phases, also with the symptoms, and we have learned about these triggers and causes. Now it's time for us to know about the treatment of migraine. It's very important because in here we need medication, especially when we are under attack. We also need to have spare medications at home so that it's just handy for us. So how is migraine treated? There is not a cure for migraine actually, but a healthcare provider can help you manage migraine symptoms through the following. So first one, taking medications. Second one, avoiding migraine triggers. And third one, using alternative migraine remedies.
Okay.
So what are those medications that treat migraines? So there are 2 types of medication available. The first type would be medication to stop migraine, and the second one is are those medication to prevent migraine. So we have the one to stop or cure, but like what I've said, there is no cure for it, but to stop it, and there are those to prevent it. The first one in here is medication to stop migraines. So you can take this medication at the first sign of migraine. They stop or reduce migraine symptoms like pain, nausea, sensitivity, and more.
Okay.
Okay, so we also have the second one, which is the medication to prevent migraines. A healthcare provider usually prescribe preventive medications if you experience severe symptoms. This is already if you had the severe symptoms that interfere with your routine or have frequent migraines. These medications reduce how often and how severe migraines affect you. You can take these medications as directed, usually on a daily basis. So let's go ahead and let us learn more about this medication. So the first thing that we have to learn is about those medication that stop migraines. First one here on my list are those over-the-counter pain relievers. So these are called OTC.
Okay.
These drugs often work well for headaches. The main ingredients are often acetaminophen, aspirin, caffeine, and ibuprofen. So you see, even caffeine is also a medication for migraine. That's why they said that it should be in moderation, taking it in moderation, not too much, because that will trigger it. But if you take it, the ideal one, then that will be of help. So another consideration here is never give aspirin to anyone under 19 years of age because of the risk of Reyes syndrome. And you've said before that when your migraine attack, you are taking ibuprofen, right?
Yep.
And that's a pain reliever that will just relieve the pain. And is it working for you?
I remember it works.
Okay, so sounds good. That's a good one, but we'll just go and learn more of it. But before we go to the next one, there's more consideration here for over-the-counter drug medication, because if you take too much over-the-counter pain medication, you can experience rebound headaches or become dependent on these pain relievers. So if you are taking more than 2 days in a week, you have to talk to your provider or your doctor that they can prescribe a better one for you.
Okay.
All right. So if you remember, if you're taking more than 2 days in a week, you have to call your provider or you have to visit your doctor. Okay. Second one here on my list, and let me say this, that over-the-counter pain relievers, this can be used if you are experiencing mild, remember this, mild migraine. So if you are experiencing those that are moderate to severe, the next medication is a good one for a moderate to severe migraine. The triptans drugs. So these drugs balance the chemicals on your brain to stop the pain. So there's already that intervention in the brain to stop the pain. You might get a pill to swallow, tablet you dissolve on your tongue, a nasal spray, or a shot. So there are different ways on how you will use this medication. So you can buy this with its name: Azert, Relpax, Maxalt, Emitrex, Zomig. These are the brand names of this medication. So next one in here is the Detans, which is a tablet that eases pain, nausea, and sensitivity to light or sound. ultrasound, it comes in a pill form, and that you can buy this with its name Ravo. Next one also in here is the GIPATs. Your doctor might give you Nortic or Obrelv as their brand name, and you can take them in tablet form. You also have this Orgotamine, wherein you can buy it for its brand name Cafergot, Ergomax, Megergot. This works on the chemicals in your brain. So usually it affects the chemical activity in your brain. And last one in here is that your doctor can also prescribe nausea medication if you get nausea or you experience nausea when you're migraine attacked. Okay, so those are medications that stop migraine. So what we'll be discussing now are those preventive medications for migraine. So first, so we have this common preventive migraine medication that includes anti-seizure medications that include valproic acid and topiramate, blood pressure medications such as this beta blockers, atenolol, propranolol, and nadolol. Nadolol. We also have this calcium channel blockers, monoclonal antibodies, tricyclic antidepressant, serotonin and norepinephrine reuptake inhibitors. So with all the names of this drug, I have given you that handout wherein you can see those specific names of the drug. So whenever you will be experiencing those the severity of your migraine, you might as well check on that. Okay. So all this medication, they come in different forms. Like what I've said earlier, they come with oral medication which can be taken by mouth. There are also that you can inject it under your skin, which is subcutaneous. There are nasal spray. There are those that you can they're putting it through suppository and through an IV, intravenous. And that you have to discuss with your healthcare provider as well about specific medication or combination of medication and formulation to best manage your symptoms. So the good thing in here is that you have to work with your, consult your doctor about it for an effective management of your migraine.
Okay.
All right, but before we continue, do you have any questions?
I'm good. I understood.
All right, that's good to hear. So when you experience migraine, what will you do? I've heard one answer a while ago. You've said that you went to a dark room without any noise, without any smell, like that, right?
Yeah.
And yes, if you are under migraine attack, it's better that you go in a dark, quiet, cool room. Okay? Next one is applying a cold or warm compress or washcloth to your forehead or behind your neck.
Okay.
Massaging your scalp, that could also be of help. Applying pressure to your temples in a circular motion, so mostly massage. And of course, keeping yourself in a calm state. Okay? Because when you are under migraine attack, it's like your mind is in different sides. You are experiencing lots of pain. So of course, sometimes you experience like palpitating like that, or you feel that fear, of course, with what you are experiencing. But what you need to do is be calm. You have to be in a calm state. All right. So let's continue with alternative migraine remedies that you can do And for this one, you have to talk to your doctor before doing it. Okay? So these are alternative therapies that can help manage your migraines. First one here on my list is that you have to taking vitamins, minerals, or herbs like riboflavin, vitamin B2, magnesium, feverfew, butterbar, or coenzyme Q10. Next one is relaxation techniques like yoga,
Okay.
wherein that will help for your meditation. And the last one is acupuncture.
Okay.
But like what I've said, you have to consult your doctor before starting with this alternative therapies for migraine. All right. So we also go and discuss about lifestyle modification that can help reduce the frequency and severity of migraine. So
Okay.
I have a list of here that you need to do in order for you to manage or for you to reduce the frequency of your migraine. So this really focuses on lifestyle modification. First one is about diet. You need to have consistent meals.
Okay.
You need to eat at roughly the same time each day to avoid blood sugar fluctuations. We need our sugar to be consistent. We don't want it to go up, go down, up and down. It should be consistent. That's why you have to eat same time each day.
Okay.
And of course, not too much and not too little, but it should be the same amount as well. You also need to have this food diary to keep track of what you eat, to identify potential for food triggers, because you have those food triggers like those processed foods, refined sugar, and certain types of cheese. You also have to drink plenty of water. You need to hydrate your body,
Okay.
because dehydration can also trigger migraine. You also limit the triggers. Avoid those foods that trigger migraines. That includes alcohol, caffeine, chocolate, and artificial sweeteners. You also need to maintain a healthy weight, because obesity increases the risk of chronic headaches. Okay? You also need to take folic acid supplements, because folic deficiency has been linked to an increased risk of migraines. But before we continue, I also have here my visual aids about the migraine diet. This will, in this column, this side, you can see that there are food that triggers migraine. So I also have these pictures in here so that you can easily identify. Okay. And these are those pain-safe foods for migraines that will help, that will not trigger, or in other word, it will not trigger migraine.
Yeah, it's okay. So, I can read all
you can
this
read
instruction.
Oh, that's
you don't
good.
need to go it deeper.
Okay, there you go.
Thank you.
Okay, so after diet, we also have the sleep. Okay, you need to have regular sleep schedule. Aim for consistent bedtime and wake times, even on weekends. You need to also have quality sleep. Create a relaxing bedtime routine and ensure a comfortable sleep environment. Okay.
Okay.
That is about sleep. Next one is exercise. You need to have a regular physical activity. You engage yourself to moderate exercise most of your days of the week, such as walking, swimming, or yoga. But again, there's a consideration in here that do not exert more of or do strenuous physical activity. You do it gradually. You do it at a small pace, and then go for a moderate pace, not for that intense physical ones. So that's for exercise. Next one is stress management. You have this relaxation techniques like practice mindfulness meditation, deep breathing exercise, or progressive muscle relaxation. Also, you have to manage your stress, and there are strategies to do that. Identify the stress triggers and develop coping mechanism. Okay,
Okay.
and there are other considerations. Environmental factors, we have to manage our temperature and lighting in our environment, especially when there's a change from one season to another. We have to make sure that we have our heater already on the ideal temperature, and during summer wherein it's too hot, we also have our aircon. It should be turned on in order for us to have this good temperatures, and that will help us not to be triggered with migraine. Okay, so caffeine moderation. If you consume caffeine, do so in moderation and at consistent time.
Okay.
And lastly, you have to consult a healthcare professional. Of course, we need to work with a doctor, especially when we are encountering severe symptoms. Okay,
Okay.
and that will be our last topic: when to see a doctor. When is the time that is needed to see a doctor? I've been saying a while ago that you have to talk to your provider, you have to visit your doctor and ask for it. And there are those instances that we need to go immediately, or go to the emergency room, visit the hospital if we have all the signs.
Okay.
But before that, um, yeah, you have to see your healthcare provider immediately, or go to the emergency room if you have any of the following signs and symptoms. First one, if you have an abrupt severe headache like a thunderclap. So you know yourself, if you are
Okay.
experiencing that severe headache, you go directly to your doctor. Second one is headache with fever, stiff neck, confusion, seizures, double vision, numbness, or weakness in any part of your body, which could be a sign of stroke. These are already bad sign, like seizures, double vision. This is not a good one. So you have to go immediately, or call someone that could help you and help you go to the emergency room. You also need to go for or see your healthcare provider if you have a headache after head injury. Of course, it's all the brain processes, so you have to make sure that everything's good. A chronic headache that is worse after coughing, exertion, straining, or a sudden movement, that's also a sign that you need to see your doctor. And of course, new headache pain after age 50. So all of these signs and symptoms, these are uh, these will prompt you to go for an appointment, or to ask your doctor about all of that, all that you are experiencing. So we need the intervention of our doctors as well. All right, so I believe we're all done with our discussion, with our lecture, and now it's time for me to evaluate you with what are those that you have learned with our lecture or our topic this morning. So before we continue with it, are there any questions you want from me?
I think you elaborated it well, and every details you go
Okay.
in deep. So I think it's okay.
So it's now my turn then
Okay.
to evaluate you with
Okay.
your understanding of our topic. So with your understanding, would you be able to define migraine for me?
Migraine is something that cause severe pain in
Okay.
the head. It might
Okay.
be in the one part of the head or in the entire head.
Okay. That's right. That's right. And would you be able to give me symptoms of migraine?
Symptoms like seeing, as I mentioned before, like seeing
Flushing.
flashing light
Yep.
and a lot more like
Y- Even
uh,
the smell.
smell and the
Mm-hmm.
light and
Mm-hmm. Even the noise.
the noise. Those are,
The
yeah.
symptoms. Yeah. And we found out, and you already know before we had the discussion, that you have a migraine with aura, right? All right, so let's continue. So, can you give me medicines that stop migraine?
Like treatment medication for migraine.
Mm-hmm.
It's like over the counter pain relievers such as ibuprofen for mild migraine and triptans for moderate to severe migraine.
Okay, sounds good. That's right. All right, so my next question is that how about those preventive medications for migraine?
Preventive medications for migraine such as anti-seizure medication and blood pressure medication.
All right, great. Uh, so, with the next question, I believe that this is already like a uh, ways or those that you need to modify your lifestyle modification in order for you to lessen the severity of your migraine or the frequency of experiencing migraine. So would you be able to give me some of those or lifestyle modification, I should say?
Yeah, there should be a modification in the diet and in sleep
Okay,
and in exercises.
that's right. So how about those food that you have to limit in order for you not to trigger the migraine?
Uh, Food that need to limit are those example like food that is very high in the sugar,
Yep,
very
or
high in
salt.
salt,
That's correct.
sodium glutamate,
Yes.
and those artificial uh,
Like
preservatives
preservatives.
and artificial to make something
Good,
taste for the
better.
better
Yeah,
for the food.
that's right. And let's not forget also those aged, especially those aged cheeses, because that also triggers migraine.
Okay.
Okay, so my final question to you is that when is the right time to see a doctor?
When there is a double vision
Okay.
and when there is high blood uh, pressure, something like that,
Mm-hmm.
and severe headache.
Okay. That's correct. Because if you are experiencing in even seizures like that, you're seeing double vision, and you're experiencing it's a different kind of headache from those that you've experienced before, then it's just good for you to see or visit your doctor.
Yeah, and
Okay?
also if um, you bought the medicine,
Okay.
the prescribed, and of course, if you see some negative or symptoms from that medicine, it's also need we need also to I need or I we need to consult a doctor of the
That's right.
adverse effect of the medicine that has been prescribed.
Prescribed by the doctor. That's correct. Because if you are doing some interventions that's like what I've said earlier, even other remedies, you need to talk to your provider before doing it.
Okay.
All right. I believe that your doctor, they are more knowledgeable about all the medicines on those management plan that personalize you as the patient, because we have our own needs. We have our specific medical intervention. So it's best for us to visit or talk to our doctors. So are there any more questions for me that before we end our discussion, or I mean our lecture?
Um, I don't have any question.
Okay, so thank you so much for your time, Sir Roldan, and thank you for this opportunity of teaching you about migraine.
Okay, thank you too, ma'am, for the knowledge imparted and
You're very welcome.
all the information that I really need in order for me to. It helps when I have the migraine attack again. Thank you. God
You're
bless.
very welcome, and God bless you too.